COVID-19 critically ill patients at the height of the pandemic in Queens, New York. He completed his residency in internal medicine and chief residency at Westchester Medical Center, and he's board certified in internal medicine. He's mentored several residents on research projects related to COVID-19 and has presented and published over 30 times. Mike has a special place in our hearts. He co-founded the student chapter of Semana after being inspired from a trip to Kenya and Tanzania. He also led several mission trips to Bolivia. And he served on several different parts of Semana. So he served on the COVID-19 Semana Task Force, which was started this year, of course, the Semana Board, the Missions Committee, and the student chapter. He's married to Susie Gabriel and currently resides in Queens, New York. He enjoys biking, hiking, and exploring God's nature, along with savoring in different cuisines with his lovely wife. So thank you so much, Mike, for being here today, and we're so excited for hearing what you have to say.
Thank you, Sina. And it's great to be among brothers and sisters. And let me get my PowerPoint straightened. And let me see if I could share my screen. Let's see. Okay. Can you see my screen?
Yes, we can.
Excellent, excellent. So it's, I'm really glad to be following Dr. Albert Rossi with his amazing talk. And a lot of, actually, so we, as board members, we read the book together that he wrote, Becoming a Healing Presence. And it was definitely quite inspiring for us and transformative during the year. So my talk will be on resilience and becoming a healing presence during a pandemic, lessons from COVID-19. If you open the news during that time, these were some of the tabloids that you would see. Queens was unfortunately the worst hit at the beginning of the pandemic when we were very underprepared. We didn't know what to expect, and the whole disease was very new and foreign. And I'd like to share with you snippets of a video that was made by one of my co-fellows detailing some of the experiences of the medicine residents who did not plan to be a part of the pandemic as part of their training.
Michael, I think you have to stop using your earphones so we can hear.
Sorry, Dr. Haney?
If you use your earpiece, we cannot hear the voice.
Oh, I see, okay. Let me know if you could hear it now.
And you know they're scared and you're trying to update them as best as you can, but you really don't know how they'll end up or which direction they'll go. And I think the fright in their voice, and I think that's been something that I've been dealing with.
So this was one of the chief residents at the time talking about his experience. Here are some of the other residents.
I think most of us have had probably traumatizing experiences for us, whether it be just, like the resident before me said, having to FaceTime in loved ones to say goodbye to their passed on relatives and having to see them on the screen crying for over an hour and a half. It's very difficult, and it's the hardest part for me, I think, is that people not being able to say goodbye and having their loved ones be alone in their final moments.
A lot of situations like that, but I think one that really sticks out to me is this guy who's around in his 60s, and he was getting a lot worse in terms of his work of breathing and his oxygen levels, but he was still talking to me, and we were just discussing, what the next steps were. And at one point he looked at me and he just asked, like, "Oh, am I going to be okay?" And it was kind of a very jarring question for me. And so I just tried to comfort him and everything, and he started talking to me about his granddaughter, who was just born like the weekend before he was in the hospital, and he's like, "I haven't even got a chance to see her yet."
Very young guy, really no medical history, 40 something. On his way, like he was dying. So I FaceTimed the family, and I think it's probably been like the first time the patient's family has seen him in a while. So they were really shocked to see him dying. But that, you know, everyone's crying. They had, I think, at least 20 people in the room just FaceTiming. And I probably would have done it for longer, but my phone was running out of batteries. So I think that was pretty hard.
My patient passed away, but it was actually the patient right before his coach status was changed. So family wanted to see him one last time, and unfortunately, as we went to FaceTime, as I was FaceTiming them, that's when he passed away. So of course, as I was telling the patient family, they broke down, understandably so. But at the same time, I actually felt it was good that they were there when the patient passed, because that's the hardest part of all of this, is that patients are passing without any loved ones nearby.
I had a patient's family say that their family member is elderly, that they're currently intubated, and after this, they realize that he'll probably never come home or the same life he lived. And they would like to take him off the ventilator so someone else can benefit from it, would have a better outcome than him.
So this is just a sampling of some of the experiences of the residents were having. And as you could imagine, it was quite traumatizing to many people. They say people dying left and right. They don't know what to expect. People don't know how to manage this new disease that seems to be rampant throughout the hospital with very few resources. And
I think most of us.
This was just a couple of pictures highlighting a day in the life during the pandemic. Someone in April 4th, I saw the sticky note, noted the number of cardiac arrests and the rapid responses during that time period between 7 a.m. and 11:15 p.m. And as you could see, there was many cardiac arrests and rapid responses, way, way more than you would expect on a regular day in the hospital. This was part of our critical care team. Between one of the codes, as you can see, they're tired, they're stressed, they're sweaty, and they're trying to keep the situation under control. And as you can imagine, and this is also a couple more pictures. So we started off by having one ICU that multiplied as the days progressed. So each and every one of these columns was a different ICU that we had to open and create out of thin air to accommodate these patients. And it was a continuous discussion that we were having as to which beds were open and how to create more space for these patients, where at the height of the pandemic, we had all these ICUs full with another 30 patients that were intubated on the floor. So it was definitely a challenging time with lack of resources, many nurses, many floor nurses that were taking care of critically ill patients that were intubated on the floor with no experience, which made it especially challenging. And this is just a sampling of what people looked like walking around the hospital. And as you can imagine, this pandemic has created a toll on the mental health of both patients and providers. This was a paper published in Lancet Psychiatry, looking at over 60,000 COVID-19 cases and the impact the pandemic has had on their mental health. This is another paper detailing the effects of the pandemic on those who are taking care of these patients, those like us in healthcare. And I'm here to say that challenges are universal. They're not purely for patients or providers. You can see it in biblical accounts throughout history. When Elijah escaped from Queen Jezebel for his life, this is something he said. He said, "It is enough. Now, Lord, take my life, for I am no better than my fathers." And if this was a patient of mine, I would have to call psychiatry and to keep him on one-to-one, because I would be worried about the risk of suicide. And this was also a reminder that I have every time I board a plane, which hasn't been that frequent given the pandemic. We're always told to put the oxygen on ourselves first before we provide oxygen to those around us, which is counterintuitive. As a mother or a father, I'm sure your first instinct is to take care of your loved ones, your sons and daughters. But in reality, it's counterproductive, because if we ourselves are not well, if we are not healthy, we may do more damage than good when caring for others. So the first part of my talk is how to maintain resilience in face of adversity. And these are the main elements of the first part of my talk. I'll talk about self-care, community, solitude, prayer, storytelling, and finding meaning in suffering. And I'll rely on some of the things that I've experienced, examples from biblical accounts and from the scientific literature. So going on with the story of Elijah. So after Elijah was scared for his life, he was tired and he rested. And in 1 Kings 19:6-8, we read that an angel touched him and said to him, "Arise and eat." And then he looked, and there by his head was a cake baked on coals and a jar of water. So he ate and drank and lay down again. And the angel of the Lord came back the second time and touched him and said, "Arise and eat, because the journey is too great for you." So he arose and ate and drank, and he went in the strength of that food 40 days and 40 nights. And it's quite interesting because I feel like many times in the church community, we look down upon self-care. We maybe at sometimes we misinterpret the ascetic life as just punishing ourselves or not caring for our bodies. But in reality, God cares for us as a whole being. He cares for our body, he cares for our minds, he cares for our spirits. And it's important that we also pay attention to these different facets of who we are. I'm preaching to the choir here, but as you all know, physical activity is incredibly helpful in maintaining balance and maintaining resilience in face of adversity. I personally found that physical activity outdoors was incredibly helpful for me. This was an article looking at exercising outdoors and how helpful that may be. And these are just some of the pictures that I would take on my days off. I developed a love for biking during that time, and I would look for different opportunities in different places to explore and take pictures, which was quite refreshing for me. And this was my roommate at that time who invested in a stationary bike. So I know it's now cold, it's winter. That's definitely something to look into. The other point, of course, as you all know, is what we eat. How we feed our bodies definitely affects our mental health and our ability to withstand stress. This is an article in BMC Psychology, which noted that consumption of legumes, fruits and vegetables, and a low intake of sweet foods was associated with a decreased risk of depression. Thankfully, there was no difference in the consumption of chocolate. So if you like chocolate, no issue there. And this was another study looking at the association between diet and mood. And it found that a diet which is low in salt, vegetable-based and glycemic load-based ketogenic and paleo diets could have a positive impact on our moods. The second point that I would like to discuss is community. And I'm blessed to have this wonderful community of Semana that we are currently in, and to have the Coptic Church and our local community that supports us throughout our lives. And this was a study looking at ways where in the Southeast Asian indigenous communities, having that strong connection to their community was especially helpful for their well-being. And thankfully, we were surrounded by love from our community during that time. Daily for lunch and for dinner, we would have donations from local restaurants, bakeries, with plenty of food to help us during that time, which was invaluable, and it allowed us to gather together and have a meal together. This was a picture of the meal that I had that was prepared by my roommate at the time during the Feast of the Resurrection. And even though it doesn't look so appetizing, it was quite delicious. And again, it wasn't very elaborate like usually used to with my family, it was quite memorable, and it was quite helpful at that time. These are also some of the things that we would see around us. Cards written by members of the community. This was bottles of wine that were gifted to us from a volunteer group from UCSF. So again, during the height of the pandemic, because of the lack of manpower, we had volunteers come in from around the country from different centers, Cleveland Clinic, UCSF, and others, to help us during that time. So it was great to be supported by those around us, near and far. This was what we saw on our walk into the hospital. Again, supporting the cause and keeping the spirits elevated. And it's something that we also value at Semana, and I think that's why we put a special emphasis on the mentorship program. I think as a community, we need to continue to support each other by mentoring and being mentees of each other. And this is also why we have the COVID-19 symposium, to help support those in the general community that might not have had access to information at that time. And I also invite you to join us during the open forum on the COVID-19 vaccine, which has created a lot of confusion in our community. It will be this Sunday, and it will be a great time to have this discussion. We also had a video created for graduates that couldn't celebrate in person to help celebrate their accomplishments as one community. And we also had a series of lectures, of spiritual support series, to help, again, support each other during this time. Given also the recent events with reports of sexual abuse, we created survivor support groups that help those who have been affected by sexual abuse in their past to come forth and to be in community and to be supported. The third point that I would like to discuss is resilience through solitude. So going back to Elijah, after he rested and he ate and he drank, he went to meet God. And it says that, then he said, "Go out and stand on the mountain before the Lord. And behold, the Lord passed by, and a great and strong wind tore into the mountains and broke the rocks in pieces before the Lord. But the Lord was not in the wind, and after the wind, an earthquake. But the Lord was not in the earthquake, and after the earthquake, a fire. But the Lord was not in the fire, and after the fire, a still small voice." And it's quite interesting that Elijah was not able to find God in the chaos, in the wind, in the earthquake, and the strength of the fire, but rather in the still small voice. And echoing what Dr. Albert Rossi had mentioned in his talk, I think we find God and we find ourselves in the moments of solitude and of silence. Meditation and solitude are touted by evidence-based medicine. We see evidence in research on Alzheimer's about the effect of meditation on decreasing your gray matter atrophy, and how mindful meditation could be helpful in chronic pain. This is an interesting article, especially recommending further research of Christian meditation, taken from the practice of ascesis, from the traditions that we have in the Coptic and Greek and other Orthodox traditions of having a meditation that is focused on the person of Christ, and how that may be helpful. I was having a discussion with Jasneet, who's with us here today, and she's had experience growing up with meditation from the Eastern rite, from Buddhism and Hinduism, and she was telling me how different that can be from having a Christian mindset to meditation. We're typically told in meditation in the Buddhist tradition to empty our minds and to keep it like a blank slate. This is quite different from our Christian tradition of meditation, where we, instead of just emptying our mind, we fill it with the light of Christ, and we center ourselves on the word and on the name of Christ, which gives us strength and prevents us from just being an empty and hollow organ, but rather an organ that is filled with his light. Going back to Isaiah, he says that, for thus says the Lord God, the Holy One of Israel, in returning and rest you shall be saved. In quietness and confidence shall be your strength. And it's obviously quite challenging to do so when we're busy. I could tell you that when we're in the hospital and we have a cardiac arrest after cardiac arrest and a rapid response after rapid response, it was quite challenging. But even finding a couple of moments of quietness just to gather our thoughts and to center ourselves was incredibly helpful. Saint Basil tells us that we return to ourselves, and having returned inwardly, we ascend to God. He notes that in order to ascend and to connect with God, we first need to return to ourselves. And we have the Jesus prayer that is described in the Way of the Pilgrim and by many monastics as a way to achieve that. In the Way of the Pilgrim, a quote that I liked was when he said that, not only was I experiencing deep interior joy, but I sensed a oneness with all God's creation. People, animals, trees, and plants all seem to have the name of Jesus Christ imprinted on them. So when we connect with the name of Christ in stillness, we are then able to connect with our patients on a deeper level, with our brothers and sisters, with those that are working with us. And we're able to provide a sense of healing for ourselves and then for others. By seeking stillness, we then can become a healing presence. And this starts by just having an exterior silence and giving us moments and a time dedicated for silence, which transforms us into prayer beings and allows us to be at peace despite whatever is ongoing on the outside. The fourth point I'd like to discuss is resilience through prayer. As you know, during the height of the pandemic, loved ones couldn't be with their family members who were sick in the hospital. It was just too much of a risk for them and for the community for them to frequent the hospital and to go in and out of patient rooms, especially with the lack of PPE that we had during that time. This was a picture that I captured on the outside of the hospital, where I saw family members kneeling and standing in prayer. And it touched me on a deep level to see people that couldn't be with their loved ones, but yet knew how much the prayer could be impactful in connecting them with their loved ones. And we know that prayer may not change the situation, but it ultimately changes us. It allows us to connect with a source of peace and strength in God. At that time, my father-in-law was actually one of the first patients to contract COVID in the Buffalo area. And it was, again, a very new disease, and no one knew what was going on. He presented to the hospital, was sent away from the ER, and then the following day he went to a different hospital and was admitted to the ICU. And the youth group at Buffalo started having prayer meetings for him. Again, it was especially challenging seeing the high mortality and morbidity rate, especially in elderly patients, and trying to navigate this process was definitely challenging. But I personally found that having those times of prayer were especially helpful and provided the family and myself with a lot of strength. And by God's grace, he was later extubated and is now doing fantastic and is back to his regular, active, busy life. The fifth point I would like to discuss is storytelling. And the church teaches us the value of storytelling. We have daily stories of martyrs and saints that encourage us and provide us with a guide light to follow, and gives us strength in times of despair. We have midnight praises every day that chronicles how the Israelites were saved from the land of Egypt and how God was with them during this hard time. And it again provides us with strength. And we again have many biblical accounts and stories of saints. And I think it's so important that in England, on their gold coin, St. George is on the other side from Queen Elizabeth, noting how much having that story imprinted and having it as a daily reminder could be very impactful. And I think that's why we think the newsletter is very important, and that's why we also started Samana Stories, because I think we grow when we learn from each other's stories. We are strengthened by each other's accounts, by how God was with us at different times, but by how we experienced God at different moments, and that provides us with strength for the road. This is just a sampling of some of these different stories where people have had different experiences during their mission trips abroad. So I encourage you to submit your stories and to participate in the newsletter and to read it. We also, as a medical community, by sharing our story, we were able to, by sharing our story, we were ourselves strengthened by chronicling our experiences in the medical literature, and by communicating that with others through different conferences. We found that we were able to find a purpose and a vision beyond our ongoing struggle with the disease, that our knowledge and our mishaps and our mistakes could be beneficial for our knowledge and for the greater community. And this is just a sampling of some of the things that we had worked on. The sixth and final thing that I'd like to discuss with resilience is finding meaning in suffering. This is a great article looking at meaning-centered psychotherapy in the cancer setting, and how finding meaning and hope in the face of suffering could be very beneficial. This was another article which was also quite interesting, looking at the meaning of life and how the representation of death was very important. So they basically looked at cancer patients, and they looked at how they looked at death. Was death simply the end all be all, or was it a passage to something else? And also how they looked at the meaning of their life and their suffering. Was there still meaning at this time when they're suffering from their disease process, or was there no longer a meaning to their life? And they found that those that looked at death as a passage to something else reported lower levels of distress, anxiety, and depression, which was quite interesting. It's ultimately not suffering that creates issues and challenges for us, but rather how we perceive that suffering and whether we could find meaning through that. And this is where the concept of redemptive suffering comes in. I like this quote by Dr. Albert Rossi, who we were blessed to have earlier this morning from his book, Becoming a Healing Presence, where he says that suffering that is meaningful for the Christian believer is redemptive, that Christ suffered for us to save us, to help us, and to heal us. He allows his followers to suffer, to participate in his way. And we see these in patients who are critically ill, who decide to donate their organs. And we can see even how by focusing on what they can give, they are comforted, and how the family, when they have that option of having their loved one live on through others, they could be comforted. I remember a story of one of our COVID patients who was very critically ill, but he decided to be intubated, and one of the reasons that he cited was that he was the sole provider for those that have come to this country as family members, and they were basically relying on him to maintain their legitimate presence in the country, and that if he had died, all their paperwork that they were working on would have no value at that time. So finding meaning through your suffering could be incredibly helpful, and also guiding your patients and finding meaning through their suffering could be impactful. The second part of my talk will be on how to become an effective healer through turbulent times, and I will draw on a lot of the wisdom from Dr. Rossi. these are the main points that I will be discussing. The first point is to blossom where you are planted. We saw that in the hospital where we had people from different specialties overnight become COVID-19 hospitalists and taking care of critically ill patients, cardiologists, gastroenterologists, etc., that may have not had experience with dealing with that population, had to basically adjust and to learn to cope and manage these patients. I was a first-year fellow at that time, and I can promise you, this was not discussed in my interview, that I would be part of a pandemic or that I would be an ICU attending during my first-year fellowship. But here I was. I was a first-year fellow, and the following day I was managing an ICU fairly independently. And it was quite challenging, and it was quite scary, honestly, at that time. But it also ultimately forced me to be more responsible for my patients and to really dig into the literature and to really know what I could offer each and every patient that I had. My fiance at that time, who was a third-year medical student, was told that she cannot continue her rotation because of the lack of PPE at the hospital, and basically went home. And obviously for her that was also distressing. And I've heard that from other people in medical school who were, again, part of their rotations, but they couldn't continue them, and they had to continue their rotations virtually. Obviously, again, it was quite challenging, and she decided to go home and to be with her parents. Luckily, or by God's provision, the day that she went, her father was feeling ill, and she decided to take him to the hospital. His symptoms were mostly GI symptoms, which were very atypical of COVID-19, especially early on when we didn't know much of the disease. And he was, again, sent home from the ER directly. The following day, he continued to feel ill and was taken to a different hospital. And that same day, he was admitted to the ICU and was positive for COVID-19. And the subsequent day was intubated on a ventilator. So by God's grace and by God's provision, he plants us all at different times in different locations. And by finding our purpose where we are able to fulfill the purpose that God has designed for that given time, despite the challenges that we may be facing. And this was also true for us as an organization that focuses a lot of its efforts on international mission work. Obviously, because of the pandemic, it was quite challenging to organize trips abroad because of the health risks to everyone who may be joining these trips. And instead, we focused our efforts on our communities here by starting the COVID-19 initiative and providing both medical hotline and a mental health hotline, along with the other initiatives that I discussed earlier. The second point is avoiding the Savior and Messiah complex, which Dr. Albert Rossi mentioned. This is a quote from his book where he says that I, as a healing presence, walk with others in their pain and in their joy. I don't take on their suffering in a futile effort to make them feel better. And he basically compares the points of empathy versus sympathy, and how if we take on the burden of others, we could easily fall under the weight of that burden. And I can tell you this is especially true doing critical care. After the second or third cardiac arrest of the day, you know very well the limitations of what you could offer patients. You know how much you could offer these patients given your knowledge of physiology and pharmacology, but at the end of the day, we are quite limited. And the sooner we know and understand that, the more we are then able to provide healing for ourselves and others, and to focus on what we could truly offer them in their times of pain and suffering. The third is shunning false praise. This is very true, especially for us in healthcare, where we sometimes may be praised because of our efforts that we do, which is great and all. It's great to feel that we are supported by our communities, as long as that does not become our main motive to do something good, which could ultimately rob us and those that we provide care for from the purpose of what we are doing. The fourth is gentleness as a mindset. Again, it's easy to lay aside gentleness when we are swamped with critically ill patients and patients that are dying, and we feel that it's impossible to do so. But if we don't, we are at risk of hurting ourselves and hurting others. This was, if you open the news during that time, this was a story from the head of one of the ERs in the New York Presbyterian system, who committed suicide, who was, again, treating patients during the height of the pandemic. And again, this was challenging throughout for everyone who was taking care of these patients. But you could see that if we're not gentle with ourselves, we could easily fall into this trap. And by doing so, she obviously was not able to care for many others who needed her care. This is also true when we're caring for others. Again, it was challenging to be with patients personally. As you can see here, these were some of the ideas that were being done in different hospitals, where the poles with all the medications were taken out of the patient rooms to decrease the use of PPE and to prevent cross-contamination and providers coming in and out of patients' rooms, which was pretty brilliant. But on the other hand, with the population that was already isolated from their family, this created extra isolation where providers would also frequent these patient rooms much less. I'm reminded by a story that my father-in-law shares, where during his time in the ICU, he recalled specifically one nurse, his name was Spencer, who would take the extra time to come into his room to spend time with him and to take care of his needs, despite the risk of contracting the disease. So he didn't remember the physicians and all their knowledge and their wisdom of the disease process, but he did remember this one nurse that took the time to spend with him and to be gentle with him. The fifth point is healing through being present. I have this quote from Bishop Felicius Ware that he shares with us, where he says that we can only meet God and his creation in the present moment. We ultimately are able to provide our greatest impact in the present moment by being present and by being here. When we are with patients, by providing us extra time and just being in the moment, we're able to care for that one particular patient. I'm remembered of a story where after, this might have been like the third or fourth rapid response overnight, and I was with this lady, elderly lady, typically very healthy, who contracted COVID-19 and was requiring very high levels of oxygen. And the next step was going to be to intubate her and place her on a ventilator. She refused that, however, and she didn't have obviously any family around, and she was looked to be quite in distress, and there was, again, no one there to support her. And I was just there with her, and she grabbed my hand, which then forced me really to just focus on her at that time and to just center myself in her presence. And I can tell you that through the layers of gloves that I was wearing, I felt a true connection with another human being, and by providing her with that comfort, I myself was also comforted and strengthened to take care of the next patient. The sixth is listening. By listening, by emptying our minds from our stereotypes and coming in with a list of questions that we want to ask each patient, we are then truly able to hear them and to care for them. If we come in with perceptions of patients, which happens all the time, right? This patient is morbidly obese. This patient is a drug seeker. This patient is a frequent flyer. He is non-compliant, etc., etc. We come in with a preconceived notion and idea that may allow us to put a filter or a barrier between us and them, and to continue to manifest the cycle of them coming and seeking care that they're unable to achieve and to receive. The seventh is finding opportunities and challenges. During that time, because of the challenges and the lack of supplies that we had to think of different ways to care for these patients. Physicians that were intubating these patients were especially worried and scared, and rightfully so. And some of the ideas was having just a physical barrier between them and the patient that they were intubating. Another idea that came up was having a VR system that actually allowed some physicians to be in more than one place at a given time because of the lack of staff. So basically, someone in the room with the patient would be wearing this and would be seeing the patient, looking at the vitals, etc. And a physician on the outside in a different room, in a central location, could be looking at that patient, could be able to look at vitals, labs, imaging, and pull up those imaging findings on the screen here for the patient, for the person in the room as well. The other was the idea of proning, which is fairly well used in patients with ARDS, and we know that it's incredibly helpful in that population. However, it wasn't really used in patients that were awake, that were not intubated. And it's something that we tried using early on, and we found it incredibly helpful in preventing patients from being intubated early on and providing them extra time and maybe preventing them from getting intubated altogether. The eighth point is healing with gratitude. And again, looking at the literature, there's plenty of accounts of how having a mind of gratitude could be incredibly helpful and supportive for us. This is also true in patients with breast cancer, with fear of recurrence, where they found that patients who had this gratitude intervention were able to worry less about the risk of recurrence and thus lead a healthier life. And these are just some other quotes from the science of gratitude that detail the benefits of gratitude in with the various medical conditions that people suffer from. This is also true in the life of our church. Thankfully, our church teaches us these things each and every day through Thanksgiving prayer, which starts off almost every service that we have and every prayer that we have. We also have the midnight praises where we are encouraged to praise God and to give thanks. And even in suffering, we're taught by St. Paul, for example, in Philippians, where he says that because of my chains, my brothers and sisters have become confident in the Lord. So because of his chains, he was able to praise God and to give thanks to God. And this was especially true in the pandemic, where things that we took for granted, like PPE, for example, were now something that we were incredibly thankful for. Having extra time with our family was incredibly beneficial and something that we were thankful for. People were trying to get pets at home, and there was a spike in people trying to acquire pets. My brother, for example, wanted to get a dog for his daughters, and there was simply no dogs that you could find, and they ended up deciding on getting these two kittens at that time. And it allowed us to also value things like church, where we were forced to experience church from our living room through Zoom. And we now, I think, have a deeper appreciation for our time in church. The ninth and final thing is embracing ambiguity, which we definitely see and we saw during this time. And this was an interesting article in the surgical literature looking at the best and worst case scenario and using this to guide our discussions with patients and providing them with their options. And ultimately, to conclude, we know that Christ is our anchor. We know that when he is in the ship and there are storms, that his presence there quiets the storm and the sea, and we could be anchored in him. So I hope some of these things could help you during the rest of our time during this pandemic and during the struggles that we will continue to face during our lives. Thank you.
Thank you so much. Juju, do you have questions?
Yes, so we have a few questions. So in the beginning, you were talking about meaning in suffering. That concept is kind of difficult for a lot of people. So how can we see God's goodness and plan in suffering and death, or at least during it?
It's a great question, and it's something that I think everyone struggles with at different times. I think by looking at what it is that I could do with this time of suffering, what is the value of the suffering? How could I minister to others during this time of suffering? How can I glorify God during this time of suffering? And thankfully, we have many examples, many biblical examples of people that were suffering and that were struggling, but found a reason to glorify God through that suffering. That's also why we are told to remember how God was with us at difficult times, and that may provide us with some strength for our times of suffering.
Awesome, thank you. And then a little bit later, you were talking about self-care and how important self-care is. How do you find time in your busy schedule to do all these activities and meditation? How do you make time for it? What's your best advice?
I think if you recognize that if you don't take care of yourself, you will simply not be able to take care of others. You will have to prioritize it. When you feel that if you are completely burnt out and you're not able to function well, you will simply not be effective in your work. You will then have to find the time to do these things. And when you do these things, you will find the value and how much more efficient you can be with the rest of the time that you have in doing the things that you're doing for your job, for your family, and all these other things that you're entrusted with.
Awesome. How can we become more deliberate with community connection despite the restrictions and social isolation? I know that was a big deal for a lot of people this past year.
Absolutely, it's a great question, Juliana, and I think we have Zoom, so we're kind of stuck with that in many ways for now. But I've seen people use it fairly effectively. People spend more time talking with each other over the phone, and thankfully, with the vaccine out, hopefully this will be past us in the next several months. I just wish and pray, and that will allow us to come again in person and to really value our time together, which maybe we took for granted before. But I can tell you that our meetings, that simply just gathering with you all is very beneficial and provides myself with strength as well.
Exactly. And then kind of going off of that, how can we best deliberately use isolation to connect? Even though I have more time in solitude, I find it easy to get distracted and end up with no time for God.
Sorry, Jenny, I cut off, but I think from what I gathered, the question was how to use our times of solitude to make it impactful and beneficial.
To connect with God, sorry.
Yeah.
Rather than get distracted.
Right. And again, the beauty is for us in the Christian tradition, we have Christ to center ourselves in. We have the name of Christ that we are advised to use and to meditate on. This concept of quiet time and taking a passage in the Bible and meditating on it, ruminating on it, like a camel who chews on something and swallows it and chews on it again, just continually meditating and being present with the Word of God, like tea that kind of infuses itself in water, and the longer it stays, the more it takes on that essence.
Thank you so much. And then lastly, how can we be more of a healing presence with patience when we feel hard pressed for time? Actually, I have one more question after that.
It's challenging. It's definitely challenging. I can tell you that firsthand. But also, it really doesn't take that much more time. There is literature saying that simply by sitting next to a patient as opposed to standing, they feel that you spend more time with them. by just having this personal connection, by holding their hand, by looking into their eyes, by being present during this short time that you have with them, you could be much more impactful, despite the short period of time that you spend.
Thank
So
you.
I think it's ultimately about being present, being in the moment, and focusing on that one patient that you're with, and stepping away from everything else.
Right. Awesome. And then lastly, I just got another question. If you have any quick thoughts about the vaccine, when will life return to somewhat normalcy from the critical care perspective?
Yeah. So again, I encourage you to attend our webinar coming up on Sunday, which will all be about the vaccine. It's right now being rolled out mostly for people in on the front lines in healthcare, and as it becomes more available to the public and more people are able to receive the vaccine, we're hoping that will provide a level of immunity where people could kind of resume a certain sense of normalcy in a way. Although we don't know how similar it will be from prior to the pandemic.
Thank you so much. And if anybody else has any questions, feel free to jump in or message me. But for now, I think that's all we have.
Thank you, Juliana. Thank you, everyone.
All right, thank you so much, Mike. Does anyone else have any other last minute questions or comments or anything else? I think it's so helpful.
Sorry, I'd like to thank Mike. Sorry, I was trying to say something. Mike, I just want to thank you on behalf of all of us here, obviously for your service as a physician on the front lines. Obviously, you know, I'm sure it was a very unique experience and probably something that will never happen again in your career, hopefully. Hopefully. But of course, thank you for your service and as an example for a lot of us. So I think we are all very appreciative of that.
Thank you, John.
Yeah, I absolutely want to echo that. Thank you, John. We're so lucky and blessed to have you on the board and to have you speaking today, and just hearing from someone who is working in the ICUs every day and kind of went through all of this. And like you said, you were kind of thrown into working basically as an attending, and all the videos in the beginning too, very real, very emotional. So we really appreciate all the tips of how we can gain resilience and how we can become a healing presence with all of this.
It looks like we have one more question. I don't know if you want to answer that now. Somebody asked how to defeat the fear of dealing with a COVID patient.
Yeah, it's a real fear, and fear is there at times. It's helpful. It's helpful to have that fear, but and we all were, but we were careful. We put the PPE that we had to wear. We wore our masks and our shields, and that was kind of it. And I could tell you, I was working in open ICU units where there were countless patients with no barriers, nothing, and we were just wearing our suits and our shields. And I'm okay. I can tell you that I did not get sick during that time period. So I think as long as we're careful, and we were just we put on the proper equipment and we wear our masks, that will definitely go a long way.